Hello, and welcome to our presentation on plant-based eating for kids and teens. Today, we're also going to be talking about plant-based eating through pregnancy and lactation as well. So thank you for joining us, and we hope you enjoy. At the end, we'll provide our contact information. So if you'd like to reach out to us for further information, we'd love to hear from you.
I'm going to take a minute to tell you about Sweet Pea's mission. Our mission is to grow public awareness of the health benefits of plant-based nutrition and provide tools to make a plant-based lifestyle attainable for all. And since the start of our nutrition coaching program, we've been able to impact the lives of over 400 clients. And this is so important because our vision is to cut the chronic illnesses killing Americans in half. So when we look at the leading causes of death for those of us in the United States, 5 of those can be prevented or completely reversed by following a whole food plant-based diet. Some of our values are that we work sustainably. We work closely with Headwater Food Hub and Full Moon Farms Organics to be able to use local produce and products, organic as much as possible to be able to create our delicious food. Our kitchen also composts kitchen scraps, and our dietitians don't leave any sort of paper trail. We do everything electronically. We value our people, whether it's our clients and our customers or our vendors, and we also value our coworkers. And we do all of this by always doing the right thing. All right, my name is Kendra Horn. I'm a registered dietitian nutritionist and certified health education specialist. I've been in RD for 15 years. I completed my undergraduate degrees in dietetics and health studies from Miami University in Ohio, and my master's degree in human nutrition from the University of Alabama. I've worked in clinical dietetics in hospitals and as a consultant dietitian and long-term care facilities. I've also worked in community nutrition through cooperative extension and have taught for several different colleges and universities across the United States. I've been with the University of Maryland's global campus for the last 7 years, and I've been with Sweet Pea for 2 years. I have been on a plant-based diet for the past 11 years, and prior to that, at least 10 years, I was a lacto-ovo vegetarian, which we'll talk more about here in a minute. I have an 11-year-old and a 7-year-old, and I'm actually 5 months pregnant too. So this topic that we're talking about is really near and dear to my heart. And now Jen is going to introduce herself.
Thanks so much, Kendra. My name is Jen Nguyen, and I'm the Director of Nutrition at Sweet Pea Plant-Based Kitchen. I completed my undergrad in nutrition dietetics from Cal State Long Beach and later moved to upstate New York to complete my dietetic internship through Cornell University. After completing my internship, I became a school dietitian. That was where I did one of my community nutrition rotations, and I also worked per diem at Highland Hospital to keep up with my clinical skills. I'm also a certified personal trainer and have been training for about 10 years now. I'm a new dietitian, so I've been a dietitian for about 3.5 years. Right when I joined Sweet Pea, I completed the plant-based nutrition certificate program through the Center for Nutrition Studies. On the side, I'm very involved with the dietetics profession, serving as an inclusion, diversity, equity, and access chair or liaison for the cardiovascular and wellness nutrition group, and then also the assistant inclusion, diversity, equity, and access liaison for the vegetarian nutrition group. Currently, I reside in upstate New York, and we have a little boxer. We love hiking the high peaks, the trail running, and cooking plant-based meals. And I am new to whole food plant-based eating. Sweet Pea inspired me to explore this lifestyle. I was pre-diagnosed a pre-diabetic in my early 20s, and since then have been able to manage my blood sugars through diet and exercise. And I love what I do for Sweet Pea because it gives me an opportunity to educate not only on nutrition, but also to connect with my clients and share strategies on what's worked for others, what the science says, and what works in terms of whole food plant-based eating for everybody. So now we're going to go into the various subcategories of vegetarian dietary patterns. When we talk about the word diet, it's used to describe how food and beverages are regularly consumed as a part of an individual's life. Individuals may also subscribe to specific diets for religious, cultural, or also medical reasons. So, under the umbrella of vegetarian diets, we have 7 different subcategories here. So, first we have lacto, which excludes meat, fish, poultry, and eggs. So, an individual who subscribes to this will still eat dairy. And then we also have ovo vegetarian, which excludes meat, fish, poultry, and milk, but still, this individual may still consume eggs. And then we have lacto-ovo, which excludes meat, fish, poultry. So this individual still eats eggs and dairies. And we have pescatarian, which is primarily fish. And then we have poultarian, which is primarily poultry. And then you have vegan and also whole food plant-based. So on this chart here, you see the differences between someone who is vegan, plant-based, and whole food plant-based. As a sidebar note, there is no universal definition for plant-based eating yet, but what you see here is that someone who is plant-based may still consume meat, poultry, seafood, eggs, and dairy, but also consumes oils and potentially highly processed foods. The purpose of shifting over to whole food plant-based diet is to reduce or to avoid the amount of animal products and also highly processed foods that we consume. By decreasing the amount of ultra-processed foods, we're also reducing our risk of nutrition-related diseases such as heart disease, stroke, certain types of cancers, diabetes, and chronic kidney disease. In the past 3 years, we've seen new studies and more research is revealing that increased consumption of highly processed foods or ultra processed foods are linked to increased mortality and also poor health outcomes. So, what we do know is that by reducing your intake of these ultra processed foods, that can decrease your risk. And by including more whole foods, we can greatly benefit by seeing improved energy levels, blood work, mood, even better performance, and also decrease inflammation. So let's talk about the different food groups that are included in whole food plant-based eating. Foods that are included on a whole food plant-based diet are abundant in terms of vitamins, minerals, and phytochemicals or phytonutrients. When you look at the foods that are included versus reduced or excluded, there's a much larger variety of food. So within the vegetable category, there are thousands of species of different types of vegetables and also fruits as well. And then you have 10, dozens of whole grains and nuts and seeds, beans and legumes. So when we put these foods together in a combination of a meal, the foods and the combinations are endless. The other thing on the included list is this also includes minimally processed foods, which are foods that are considered unprocessed, maybe slightly altered, where the food still retains most of its nutritional properties. And those examples include bagged spinach, potentially some frozen vegetables, roasted nuts and seeds, and also your plant-based milk. So those are just a few examples. On the reduced and the excluded list, we also have oils. The reason why oils are listed on here is that oils are considered highly processed. So those examples include vegetable and soybean oil. These oils, commercialized oils, do go through a process known as refining, bleaching, and deodorization, also known as RBD. During this process, there are a lot of carcinogenic compounds that may be produced and lots of chemicals that are used in the process. Oils are also very calorically dense and also lack nutrients when compared to whole foods. So you can see that what we're trying to get individuals to do here is to shift more towards the foods that are included. The more that you shift towards the foods that are included, you'll gain benefits almost immediately. And we have seen that with a lot of our customers and a lot of our clients. Again, the more that you lean in the direction of plant-based eating, the more gains that you'll receive. So now we're going to go ahead and transition over to talking about plant-based eating from pregnancy through the various life cycles as we start to age. So I'm going to be starting off by reading a statement from the Academy of Nutrition and Dietetics, also known as the A&D. The A&D is the largest organization of nutrition and dietetic practitioners and professionals. So here it is. It is the position of the A&D that appropriately planned vegetarian, including vegan, diets are healthful, nutritionally adequate, and may provide health benefits for prevention and treatment of certain diseases. These diets are appropriate for all stages of the life cycle, including pregnancy, lactation, infancy, childhood, adolescence, which we'll all talk about today, older adulthood, and also for athletes. Plant-based diets are also environmentally sustainable than diets rich in animal products because they do use fewer natural resources, and they are associated with less environmental damage. Vegetarians and vegans are at reduced risk of certain health conditions, including ischemic heart disease, type 2 diabetes, hypertension, certain types of cancers, and obesity. And this has been evident in research for many decades now. A diet that is low in saturated fat and high in vegetables, fruits, whole grains, nuts and seeds, legumes, and soy products, which are all rich in fiber and also phytochemicals, are characteristics of a vegetarian and vegan diet that can produce lower LDL cholesterol and also better blood glucose control. And these factors ultimately contribute to the reduction of chronic disease. Some important things to note is that vegans, potentially some vegetarians, need a reliable source of vitamin B12. And we'll talk about some of these nutrients of concerns next. So what I'm going to be talking about are the general nutrients, and then what Kendra will do is she'll go into the specific age ranges and life cycles. So when raising kids on a plant-based diet, it's critical to ensure that kids, teens, infants are receiving adequate nutrition as they are growing rapidly. And there are periods throughout the life cycle where kids and children may need more nutrients than others. So here you on the table here, you see the primary nutrients to focus on. So protein is important for growth, recovery, repair of tissues, muscles, skins, organs, and the immune system when we're producing antibodies. And those sources of proteins on a plant-based diet includes beans, grains, soy products, potentially meat analogs, nuts, seeds, and nuts and seed butters as well. And then we have vitamin B12. Just like adults, it's important for brain health, cognitive, and also nervous system function. And you find vitamin B12 in plant-based milks, meat analogs, breakfast cereals, and nutritional yeast. And then we have vitamin D and calcium, which combined are important for bone health and also immune system function. And we find these sources in the sun, of course, during the summertime, and wherever you live where there's sunshine. Plant-based milks that are also fortified with vitamin D and calcium, orange juice, and also some cold cereals. Omega-3 fatty acids. So a supplement is recommended, especially during pregnancy, and is important for kids for growth and development of their brains. There's also some evidence suggesting that omega-3s may be helpful in reductions of the ADHD and improvement in sleep and also performance in school. And we find omega-3 fatty acids in a lot of your seeds, so hemp seeds, chia seeds, flax seeds, and then walnuts. And then if you're looking at dietary supplements, there are algae-derived omega-3 fatty acid dietary supplements. Next, we have zinc. So zinc is a trace element or a mineral and functions very similar to protein in that it helps with tissue growth and repair. And we find zinc in beans, nuts, fermented soy products, oats, and whole grains. And the next mineral that we have is iodine. So deficiency can occur in children, and it affects cognitive and also motor development. Iodine is important for thyroid function in that it produces hormones released by the thyroid gland. And lastly, we have iron. So iron helps move oxygen from the lungs to the rest of the body. Children can develop iron deficiency, which is actually common, and if left untreated, it can negatively affect a child's growth and development. And sources of iron include whole or enriched grains and grain products, iron fortified cereals, dried beans, of course, your leafy greens, potatoes with skins, nut butters, and dried fruits. And I forgot to list the food sources for iodine. So the food sources of iodine include iodized salt, seaweed, certain breads, bananas, and also nuts. So now I'm going to turn it over to Kendra and allow her to share about the nutrients during pregnancy.
All right, thank you, Jen. So during pregnancy, regardless of diet, a female's nutrient needs change. One of the important nutrients that increases in terms of need is protein. So a pregnant woman needs an additional 25 grams of protein a day. An additional nutrient of concern is folate. Ideally, when a woman is thinking about becoming pregnant, she would start on a prenatal vitamin, multivitamin. Otherwise, as soon as she knows that she's pregnant, because it's so important that a female have a really good source of folate, or in supplement form, it would be folic acid. That's the synthetic form of folate. Folate is important for preventing spina bifida and other neural tube defects that can affect a fetus. We find folate in dark leafy greens, orange juice, wheat germ, whole grain bread, and fortified breads and cereals, as well as beans. Another thing that changes for a pregnant female are her calorie needs. So during the first trimester, there really isn't a change, unless, of course, the female is experiencing a lot of nausea and or vomiting, and then working with her medical providers to increase the number of meals that she's having, to have more smaller, more frequent meals, and maybe increasing her calories just to make sure that what she is able to keep down is meeting her nutrient needs. But otherwise, calorie needs increase by 340 calories during the second trimester. So an example of this would be a whole wheat English muffin with avocado on there and some tofu. And then during the third trimester, the pregnant woman's needs increase by 450 calories. And that looks like a whole wheat bread sandwich with peanut butter and some banana. So very important that a female increases her protein, her folate, and then of course her calories depending on her trimester. And then the nutrient needs of concern that Jen talked about if she's vegetarian are also important too. And then hopefully once the baby arrives, she decides to breastfeed. Needs change during lactation as well. So from birth to 6 months, the calorie needs increase by 330 calories for the female, for the mom. And then from 6 to 12 months, because the baby is growing so much, she needs an additional 400 calories. But there's lots of benefits to breastfeeding, and which is why it's really what's best for a baby. Breast milk is exactly what the baby needs in terms of percentages of fat and protein and carbohydrate. Breast milk is really easy for the baby to digest. It includes growth factors that helps the baby to grow like it should. And if the recent issues with getting formula isn't enough of a reason, breast milk also contains probiotics that help to a healthy gut biome to be established for the infant, which helps to boost their immune system and make them less likely to get sick. There are antibodies in breast milk that pass from the mother to the infant. So any sort of infectious illness that the mom has had, that baby will be protected from. Babies who are breastfed are also less likely to develop obesity later in life, diabetes. They're less likely to experience sudden infant death syndrome. And if the mom breastfeeds for more than 6 months, then the child is less likely to experience cancers that are common during childhood. Whew, sorry, I need to take a breath during pregnancy. You have more blood, and so it's harder to breathe. So taking a breath there. Let's see, what are other great reasons? When a woman is breastfeeding, she doesn't need to have any sort of preparation involved. You know, the breast milk is always available. You don't have to worry about any sort of extra things to be able to breastfeed. And then there's all sorts of reasons for the mom to breastfeed too. So women who breastfeed are less likely to experience breast and ovarian cancer later in life. They're less likely to experience chronic diseases like rheumatoid arthritis, diabetes, and cardiovascular disease. Women who breastfeed also recover more quickly from birth, so they have less postpartum bleeding. Their uterus contracts more quickly to get back to its normal size, as opposed to a woman who chooses to use formula. So lots and lots of benefits to both mom and baby for breastfeeding. So besides the calories that are important during lactation, other important nutrients that I want to zone in on are fluids. A woman who is breastfeeding needs an additional 128 ounces of water. They need 128 ounces of water a day, and that's because 90% of breast milk is water. So in order to maintain their supply, they need to be consuming a lot of fluids. Protein also remains important during lactation. So women who are breastfeeding need an additional 17 grams of protein a day. The omega-3 fatty acids, B12, calcium, and vitamin D also remain important to help with the baby's development. Then I missed something on that slide, and that was food sources to boost calories. So whether the woman is pregnant or she's nursing or we're trying to feed a finicky toddler, food sources to boost calories can be avocados, nuts and seeds and their respective butters, dried fruits, soy products, and bean spreads as well. Also, they all really help to boost calories and help you to reach those calorie needs that are increased during pregnancy and lactation. And then, like I mentioned before, breast milk is best for at least the first 6 months of life. After that, soy formula is the closest that we have to breast milk. It doesn't mimic it exactly and doesn't give all those awesome benefits that I mentioned before, but breast milk or soy formula should continue throughout the first year of life. Around 6 months of age is when we would begin an iron fortified baby cereal, and we want that mixed with the breast milk or soy formula. And then somewhere between 6 and 8 months of life, a baby is able to sit unsupported. They can sit upright. They're grabbing things and bringing it to their mouths. Their tongue thrust reflex starts to diminish. So when a baby is really young, they if anything gets by their mouth, they push it out, and it's really important for helping to prevent choking. But as their body becomes ready to start eating, that reflex diminishes, and then you know that they're ready to start eating. And so you have a couple of different routes here. You can go the traditional route of starting with baby food and progressing through pureed into chunkier versions until you get to table foods, or you can do baby-led weaning. So for instance, with my kiddos, when they were big enough and showing signs of being ready, I would give them something like a spear of broccoli that had been steamed that they could kind of mash on with their gums. I'd give them a banana or a spear of roasted zucchini to be able to mash on, of course, with supervision. You don't want to give them anything that's small or hard or round or sticky or anything like that where they could choke. But baby-led weaning is a great way for the baby to experience different textures and different tastes and eat food that more closely resembles what the rest of the family is eating. And then as they get bigger, of course, they're able to eat more variety. So as my daughter got bigger, I'd give her slivers of toast, whole wheat toast, with a little bit of peanut butter on there. She still loves tofu, so does my son. But thinking about pureed beans, soy yogurt, all really great sources of protein for kiddos. So we start with the iron fortified baby cereal, we progress to veggies and fruits, and then add in some legumes and nut butters, soy products to make sure that they're getting their protein until their diet again more closely resembles that of the rest of the family. Another thing I wanted to mention about breastfeeding is that the babies who are breastfed to supplement with B12 and vitamin D drops. So right away, if a woman's breastfeeding, she wants to be giving the baby B12 and vitamin D. If they were drinking a formula, those things would already be added to that formula. After about 4 months, then she'd want to start giving the baby drops for iron. When the baby is still in utero, there's a transfer of iron that occurs, but around 4 months of age, that iron starts to become depleted. And so that's when we start adding in the iron fortified baby cereal and then doing those drops as well. And then after 6 months of age, if the baby isn't doing a formula that would be prepared with water that contains fluoride, if the baby's exclusively breastfeeding and not doing any sort of water, and thinking about adding a fluoride supplement so that their teeth and bones can grow like they should. All right, so now on to 1 to 3 years. We want to be sure that we're feeding our kiddos a wide variety of foods. So you can see here, we went 6 or more servings of grains a day. We went 2 or more servings of legumes, nuts, and seeds. 3 servings of fortified soy milk. Of course, the baby can, of course, continue with formula and breast milk for longer than a year. We went 2 or more servings of veggies, 3 or more of fruit, and then 3 to 4 servings of some sort of fat. And fat is so important for children as their brains are still growing and are comprised primarily of fat. So thinking about nuts and seeds and their butters, avocado, soy, and olives are all really good sources of fat. Now, I never really sat down and determined exactly how many servings of every food group my kids were getting. And I didn't do that when they, moved up into the next age group. And I don't really do that for myself either. I think that when we're planning our meals, it's important to remember to include at least 3 different food groups when it comes to a meal and at least 2 different food groups when it comes to snacks. That way we're sure to include a wide variety of food groups and different foods within those food groups, as opposed to becoming really regimented with our eating. We want to demonstrate healthy eating behaviors and healthy relationships with food, because our kiddos pick up on it from a really, really young age. So eating a wide variety of foods while keeping kind of the proportions here in mind in terms of lots of grains and a source of protein, and including fruits and veggies, and a source of calcium, and of course fats. And then as the kids get bigger, so from 4 to 13 years of age, those food groups remain the same. It's just that their servings, the number of servings that they need each day, increase with their increased calorie needs as they continue to grow. And we'll talk more about what dinner or a meal looks like with kiddos here in a second, how to kind of allow the child to lead you, and allowing them to really be intuitive eaters and to eat based on what their body needs. A lot of clients that we work with are interested in transitioning their whole family to being whole food plant-based. And whether it's just eating more whole food plant-based meals, like how Jenna talked about, the more plants you eat and the less animal-based foods that you eat, the better your outcomes in terms of health. And it's the same with your family. So even if you can't become 100% whole food plant-based, the more meals that you eat that are plant-based, the better off we all are. So starting small, so thinking about 1 meal a week, maybe 2 meals a week, or switching to 1 day a week that's plant-based, and then building upon that. And we want to include family as much as possible. So if we let our children or grandchildren choose recipes, help with the shopping and the preparation as much as they're able based on their age and skill level, kids are going to be much more likely to try something that they have an investment in, that they help to prepare and are proud of. So we want to include family in making these decisions. And then if there are things that we want our kids or grandkids or the children that we take care of to stop eating, then as the gatekeepers, we should slowly stop purchasing those things. If our kids are really reliant on a lot of processed foods for snacks, then we should replace those processed foods with healthier plant-based versions, lots of fruits and veggies and nuts and seeds, and really be their gatekeeper. And as I mentioned before, thinking about including at least 3 food groups in meals and 2 food groups in snacks is really important for making sure that we're eating a wide variety of foods and meeting our nutritional needs. When someone is new to plant-based eating, they tend to, and I think it's just a common misconception, is that we just eat salad, lots of salad, or I just sit down, I eat nothing but veggies. But like Jen mentioned, there's so many things that are included on a whole food plant-based diet. We want to be sure that we're including lots of different food groups in our meals and our snacks. Okay, so one of my favorite topics as a mom to a picky eater or two is feeding children. And there's an excellent dietitian by the name of Ellen Satter who we'll include in our list of resources that you can go to check out her website, her books. But she talks about the division of responsibility around feeding children. And this can be really difficult and is very different from how most of us were raised. The first aspect in terms of roles and responsibilities is the parents or caregivers decide what and when. So parents decide what the kids eat and when. And then the children decide if and how much. And this can be really hard because that means that we give the option of saying, no, I don't want to eat, and being okay with it. And if the child isn't eating very much or they're eating a whole bunch, trying to stay out of their way. So parents decide what and when, children decide if and how much. So what this looks like is we sit down to a family style meal. If I'm serving something that is new for my kiddos that I'm worried that they might not like, I'm sure to include a variety of foods, whether it's sides or trying to keep like a spicier sauce on the side so that they're still able to enjoy what we're having. But I'm not doing any sort of short order cooking. So what we serve is what we're having. And if they decide they don't want to eat, then later when it's an appropriate time for a snack, they can have a snack, but I'm not going to make them something different. And this can be really, really nerve-wracking as a parent. We get really hyper-focused on our kids, especially when they're toddlers, and thinking about, if they're eating enough, if they're eating the right things. The studies show that over a 2-week period, toddlers are able to meet their nutritional needs if we just stay out of their way and offer them healthy foods. So knowing that our kids, they know what they need, intuitively their body knows what they need, and they'll meet their nutritional needs if we're allowing them to do so. So at this family style meal, all foods are created equal. So if we're doing some sort of treat, that would go on the table as well. If they want to eat that first, then our job as the parent or caregiver is to be quiet, not say anything good or bad, because we don't want them to have certain foods on pedestals that they think they have to get through all this yucky stuff to get to the good stuff. We want it all to be equal. And we don't want to give any sort of pressure, whether it's good or bad, because this is a place where kids really like to exert their independence. We don't want to be like, oh, I'm so glad you tried that, or, oh, you really need to eat this first. We don't want to say anything like that. We want to keep family meals really enjoyable. We want to talk about, the good things that happened that day, maybe some of the bad things that happened and what we can do about it, things that we're looking forward to, but we don't want to talk about what we're eating and how much we're eating, or if we're not eating enough. We don't want meals to become a battleground that no one's looking forward to. And again, we want to show children, a healthy relationship with food. So eating with our families and eating together. And then these children can grow up and have healthy relationships with food and eat according to what their body needs, as opposed to what diet culture says they should do. Now, there are lots of special circumstances when it comes to feeding kiddos, and it can be a little bit scary and intimidating when it comes to a school or a daycare environment, working with medical providers, peers and parties. I think the number one thing is to remember to be flexible. So if you're going to an event or something like that where you can bring something yourself, you don't do that. So most recently it was the 4th of July. So thinking about taking something that that your family can eat, working with the school or the daycare center. So thinking about when my daughter was going to daycare, I would get a copy of their menu and try to, as healthfully as possible, match what they were feeding the other kiddos so that she was eating something very similar. And then just remembering that, you know, our overall goal is health. So if my kiddos go to a birthday party and they eat regular cake, it is not the end of the world. That piece of cake will not make or break them in terms of health. So just trying to be flexible, and also give children age appropriate tools too. So from an early age, teaching children to how to politely say, you know, no, thank you, or I don't drink cow's milk, and encouraging them to speak up for what they need. You know, can I have more of the veggies, please, so that they're able to get enough food to eat. And as I always tell my clients, you know, I have yet to starve on a plant-based diet, even traveling and going to restaurants and things like that. And my children have not starved either. And when it comes to medical providers, I think I haven't had anyone really give me a hard time, but I think it's important to know that they're going to ask about, you know, what are your kids drinking? You know, how are they getting their calcium? You know, what are they doing for protein? And so having those answers ready to go can be really useful. And then, you know, reaching out for support from a dietitian if needed to help with a medical provider who's concerned. So it's definitely possible to raise kiddos on a whole food plant-based diet and to have them eat a wide variety of foods. It just takes a little bit of thinking outside the box and raising our kiddos a little bit differently when it comes to eating. And now Jen is going to talk about our resources.
Thanks so much, Kendra. That was super, super helpful, even for me without kids. I mean, I have nieces and nephews, and certainly questions come up, and all of the tips and tools that you provided are relevant to people who are transitioning to whole food plant-based eating and people who also aren't. So thank you very much for all of those resources, all of those tools and tips. Here are the resources that we recommend looking into further if you're wanting to transition. And these organizations, you can Google them or do a search online of these organizations' names. So the Nutrition Studies, Vegetarian Resource Group, the Physicians Committee for Responsible Medicine, or PCRM, the Vegetarian Nutrition Group or Dietetic Practice Group from the Academy of Nutrition and Dietetics. And as Kendra mentioned earlier, Ellen Satter Institute has a ton of tips and tools and practical advice that you can take home with you. So with that, again, if you have questions, please reach out to us. You can reach out to us via email or our social media page. That QR code that you see is to book a 20-minute consultation if you're interested in reaching out to us to learn more about transitioning. Kendra and I both have worked with many, many families in helping first parents transition and then being a role model for their kids to also be curious and potentially transition over to more of a whole food plant-based diet. So thank you today for joining us today for our presentation, and we look forward to hearing from you again and potentially in the future. So have a great day and take care. Thank you so much.
Bye.